Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. So glad that you could join us. Our guest is Dr. Shar Najafi. She's Senior Vice President of Behavioral Health for Equality Health. Joining us here on the program today to talk about her mission to provide care that encompasses the mind and body to those affected by health disparities. Welcome to Health Professional Radio, Dr. Najafi. How are you?
Thank you. I'm doing well. How are you doing?
Good. Glad that you could take the time and join us today. A very important topic. Everyone wants quality health care, the best care that is available. As Vice President of Behavioral Health for Equality Health, a little bit of background about yourself.
Yes, absolutely. I'm a licensed psychologist by trade, and I was brought on with Equality Health to a two-pronged effort. One is to help integrate behavioral health in primary care practices, and also to expand our behavioral health network to be able to provide more access points for patients and clients with mental health dispositions.
So from your perspective and your experience, what do you see as maybe a couple of emerging trends when it comes to getting these mentally ill patients the best possible care?
Mm-hmm. Well, I would first focus in on sort of the cost to our system, and I would say that hospitalizations is an emerging theme as it relates to this population, in addition to pharmacy costs that are astronomical because, unfortunately, there's a lot of misdiagnosing of mental health types of presentations, and then, therefore, there's a non-adherence to medications. As it relates to hospitalizations, I think that individuals especially with social determinants of health, don't have a very trusting relationship with their primary care physicians and or any behavioral health professionals. And so what tends to happen is when there is an acute type of symptom or when there is a crisis, they tend to utilize those acute settings to get the care that they need versus receiving care in an outpatient facility. Coupled with the fact that when there are diagnoses that are included, there's a lot of medications that are prescribed that unfortunately patients or members are not comfortable taking. There's a lack of education, a lack of trust for the system as well. And so therefore, they typically stop taking their medications around 2 to 3 week mark, which most of the medications for efficacy purposes take about a month to 45 days for there to be some effects that will be helpful to them. So I think those two areas as it relates to pharmacy and hospitalizations are really the trends that most healthcare systems want to dig a little deeper and have a better solution for.
Well, it's obviously not an easy task to properly diagnose a mental health condition the first time out or sometimes even many times out. Do you think that the cost of misdiagnosis and having to re-evaluate and re-prescribe and re-adhere to certain medications a huge percentage of the problem or to a lesser degree?
I think that has a lot to do with the overall problem. In addition to a lack of education or lack of knowledge and time for primary care physicians to really do a thorough job in terms of really identifying the symptoms that are presenting itself and then fine-tuning the diagnosis, in that 15, perhaps 20 minutes, if they're lucky, appointment time with the primary care. Most individuals who have mental health types of conditions receive their care in a primary care setting and or in an acute setting. And what we're trying to do at Equality is really try to educate primary care physicians to be able to do a better job with identifying, screening, and then appropriately referring to behavioral health when indicated, in addition to having a better access point as it relates to behavioral health so that individuals don't feel they have to utilize the hospitals to get the care that they need.
What about bringing the mental health care practitioners together so that they can better collaborate to identify where the need is and administer care where the need is found?
It's a supply and demand issue right now. What we've run into in our system is, unfortunately, the demand is high and not enough supply. However, the behavioral health organizations here in Arizona that have joined our network are very interested in making sure that those individuals with urgent needs are seen more frequently and also quicker than those individuals with, let's say, more moderate or lower needs. And so we've created a forum at Equality where we're bringing together mental health providers and primary care providers to be able to collaborate, to talk about the needs of the community, and then also really streamline what it would look like for a member to get the care that they need, depending on their symptom severity in addition to their functioning. And I think that's something that's important to address. Individuals that have those urgent kinds of needs right now, again, they're utilizing the acute settings, but if our professionals really understood what an urgent type of referral looked like, then they'd be able to accommodate them better in an outpatient type of setting.
Well, talk about one of the tools that Equality Health is using toward that end.
We're using several tools. One tool in particular is our data analytics tool that is really bringing our mental health, substance abuse providers, behavioral health, community partners, and also our primary care partners together to be able to share information and really have the ability to create a shared care plan for a member as it relates to, any type of mental health, any type of community resources needs, and also medical needs that will be shared on one platform. And those professionals that would enter into our platform would be able to augment the shared care plan and really be able to revise it and go back and forth and review medications list, which is something that the system really needs currently, especially for those members that have a lot of medical and mental health comorbidities. They're on a plethora of different medications. And so the ability to go in and actually review what medication lists are there is very powerful. And we use that tool, it's called the Health BI tool, as a way to really engage the providers and have that information readily available for them.
Again, the name of that platform?
It's Health BI, and the website is healthbi.com.
Is this a seamless transition from an existing platform to this more efficient platform?
Yes, it is. And, this particular platform, again, because there's such a need within our system to be quickly alerted if a patient has gone to the ER, to be able to review post-discharge planning, to be able to take a look at clients' medications refills and prescriptions. This platform really does give you access to real-time data and the ability to receive that real-time data versus as it happens currently, which is waiting, a few weeks to a month to be able to at least receive some kind of information about members that have been hospitalized or have chronic medical and mental health conditions.
We'd like to go online and learn some more about Equality Health and about the Health BI Care and Power platform as well. Where can we go online and do that?
So equalityhealth.com is the website for our company that has our MSO capabilities. We have our behavioral health integration efforts up online. In addition, our data analytics tool that's called Health BI. Within that, it's Care and Power. That can be found on healthbi.com. And we have a lot of information posted as it relates to how we've driven costs down and also how our providers are utilizing that tool.
Dr. Shar Najafi, Senior Vice President of Behavioral Health for Equality Health. Thank you so much for taking the time with us today.
Oh, it's my pleasure. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.